glute strength or hamstring or hip strength. And so I've known Brian for years, and a few years ago I was having IT issues, terrible IT issues. I was going to the chiropractor and they were working on my IT back over and over and over again. And talking to Brian and telling him that, he had me kind of, or we talked about it and gave me some exercises, realizing it wasn't even that it was. So I've sent a lot of videos around that he has sent me, so whenever someone said they had something wrong, I'm like, do these videos. So he was my first choice on coming to see. I know I did. Brian, he'll tell you about it.
Thanks, Amy. Brian Ranney, I'm a physical therapist. Cami Ranney is my wife. She is an original member of Parr. I've been a physical therapist for 17 years. The last 9, one more Hermann. The last 9 months, I've been at our Pear West location over here by Joe's Prep Shack. So I'm going to talk about hip strengthening, as Amy said. Who here has had an injury of some sort already? They've been interrupted in their running program.
You're lying. You're
Most studies will cite that 80% of one-distance runners at some point will be injured in some form or fashion. So, I mean, it really, that's probably more than 80% of everybody gets injured in one form or fashion. So, I want to talk about a little bit what I do. I'm a physical therapist. A typical, who has seen a physical therapist? All right. So, a typical visit for a physical therapist, the initial visit would be with, you had to do an evaluation where we would get your history, find out what the actual problem is, find out what your goals are. Is it to return to, do we have a marathon in 2 months that this is a bucket list item that we have to get and finish this race? Or is it, well, I can put off that race, but I've got a race in 6 months or a year that I'm really aiming for. So we can kind of plan the treatment session after that. After the history and finding out what his goals, what we'll do is do an examination where we're taking range of motion, strength, flexibility assessments, and then coming up with a treatment plan based on our findings there to treat whatever we find. Okay? And after that, it could range anywhere from 3 to 6 to 12 visits, depending on what we actually find. All right? So, with that, injury-wise, what we're going to talk about is hip strengthening, and why it's important for runners. Okay, so basic anatomy of the hip. We have our hip flexors here, so the motions of our hip would be hip flexion, hip abduction, hip extension, hip interrotation, and hip exterotation. So our hip flexors would be our psoas and rectus femoris, which are our 2 main flexors of our hip. Our abductors, mainly gluteus medius. That's the one we're going to be talking about the most tonight, is our gluteus medius. All right. In addition, we have our tensor fasciae lata, gluteus minimus, and gluteus maximus. Gluteus maximus would be our main extensor, hip extensor. All right. So when we're running or walking or whatever, as we are standing on one leg, our gluteus medius, its job is to hold our leg in place, like so. Okay? If that gluteus medius is not working, our knee will tend to pull in like so. So that job of that gluteus medius and gluteus maximus to some extent, and minimus, is to keep our leg in line like so. All right? So if there's some sort of dysfunction up here, so running is a series of leaping from one leg to the other. So we're on one leg, and then we're leaping to the other leg, to the other leg, to the other leg. So as we leap to this leg, if we land on here and that gluteus medius is not doing its job, that knee is going to drift inwards, and this motion is called valgus. Okay, so some people are just built into valgus. You'll see that their anatomy is to be knock-kneed, okay, and then we'll call it genu valgus. Some people are built more bow-legged, that'd be genu varus. But when that gluteus medius, that's more of a dynamic versus when you're just built that way, that's a static, an anatomical version. But for running, when the problems with running would be more of a dynamic, where I land and our knee goes valgus like so, okay? And again, that problem stems from up here. So why is a problem up here causing pain and issues below? All right, so hip pain, hip weakness here, we land, that muscle's not giving way, our knee drifts inwards. So our kneecap is right here, and as we land, that kneecap is built to stay in place like so. So if the hip is not doing its job, that knee drifts inwards, it wants to be here. We can get various strains on these different parts of our knee, causing the knee or lower leg, causing various problems, all right? So if it's pulling inwards and we're getting pain here, it could be from the ligament to hold the kneecap in place over here. On this side, the dreaded IT band syndrome. IT band stands for iliotibial tract or band. So ilium is our hip bone up here. Tibia is our lower leg, our main lower leg bone down here. So that band starts up here with the muscle called the tensor fasciolata and part of our glute, or gluteus maximus. Forms a band of fascia or just fibrous tissue that comes down the side of our leg and inserts on this lower leg part down here. All right? So that insertion point right there, if as those fibers are inserting right there, they also want to stay in line and work like so. So our knee joint is meant or built to be a hinge and work mainly in this plane like so. And so that knee is subject to these stresses. Those fibers of that IT band are inserting right here. They want to stay like this, but if we're constantly pulling in like that, they are going to rub and eventually cause friction and cause inflammation and cause the IT band, okay? So, treatments that we typically see are that foam rolling, which is great. We certainly should do that, but then also what we should do is look a little bit higher up and focus maybe a little bit more on this hip strengthening, okay? And then besides the IT band, if we just keep on going down, other problems that this motion can cause is shin splints. So we can get shin splints on there. We have shin splints that come from the front, we have shin splints from the side, and then we also have what we call medial shin splints through the side of our leg here, okay? And that is typically from a muscle of our lower leg called the posterior tibialis. And that posterior tibialis, again, wants our shin bone wants to stay in line like this, but as we land and that foot or that knee drifts inwards or our leg drifts inwards, you can imagine the stress that muscle is meant to be like this, and we're constantly, with each step of a marathon or marathon training distance, we're constantly putting a stress on that lower leg like that. And it's going to be overtaxed, overworked, again, cause inflammation, maybe even tug on that bone a little bit and cause stress fracture or those kinds of symptoms through here. If we keep going down, again, you can see my foot, not only is my leg going in, but I'll take my shoe on. The shoe that I bought at Parr.
Be sure it's simple.
So if my foot is like this, you can see as my knee drifts in, my foot is pronating. We've all heard of pronation, right? So if our foot can tend to over-pronate like so, all right? And so we can also get arch pain or the dreaded plantar fasciitis. Usually a combination of multiple things down there, but can stem from the hip also. So what do we do about it, right? So
Go see you.
go see me, number one. And number one is adjusted training too, because there's going to be an issue of tissue irritability, number one. So the tissues of the IT band or medial shin or plantar fasciitis, those tissues are going to be irritated to the point where they need to back off just a little bit, at least for a while. Let them calm down. Take medications, go see a doctor, get medically treated like so, and then come see me so we can figure out what the issue is, what the root problem is, see if it is this hip issue, and address it accordingly. All right? And so for the treatment, it's going to be an assessment. I'm going to assess how strong those muscles are. I may watch you walk or run a little bit. I'm going to watch you squat. I'm going to watch you do a single leg squat. Maybe do a lunge. And just see, is there any biomechanical faults that we can correct? All right? And so what I want to talk about now, the good stuff, is just get to what the treatment options or the treatment exercises would be. The treatments would be similar to what Amy was talking about, we will still do some soft tissue work to get the IT being worked out, make sure that we're doing some stretching to get the hip mobility going, but then finally, probably most importantly, is making sure that these hip muscles get stronger. And not only stronger, but also what we call the neuromuscular control, meaning I can do sideline leg lifts all day and get my gluteus medius super strong, but unless I can teach that gluteus medius to fire or turn on as I leap from leg to leg and keep that leg in line, then that strength doesn't mean anything. So it's a combination of the actual strength of those muscles and getting them coordinated or firing at the proper time as I land. Okay? So, exercises. Can you hand me one of those sheets or one of each? Right there, John. I don't think I brought enough for everybody, but this is in a PDF form, so if somebody wants to email me, I can hand it to you, or email out with them on there. So. Is there anybody that's dying to be a patient?
Oh, you're beautiful. Wonderful. I'm sorry. Sorry, Jamie. I love you.
Okay, very good, very good. Oh, nice to meet you. All right.
Now you're going to get injured.
First is preventing injury. You don't have to go see him if you do these exercises and prevent the injury before. Right?
So talking about injuries leads me to think about, okay, so I don't want to get too sidetracked, but why do we get injured in the first place? Who knows why most runners get injured to begin with? Form, possibly. But how many people have watched people running the marathon finish just fine and have horrible form? So I mean, we've seen that, right? I mean, we've seen someone weird age, that they are finishing and they're just fine at the end. So typically, what the number one reason is overtraining. I heard somebody say it, or more of a training error. So training error would be you're on track, you're following the Parr program or how they can run these other programs, and weekend comes and you're sick. You're supposed to run 20 miles or 15 miles, and you're sick or you're out of town, something like that. And what happens is you don't do it. You skip that run and you skip your Tuesday run. And then the next weekend rolls around, and instead of adjusting based on what your previous week was, everyone's heard the 10% rule, or has anyone not heard the 10% rule? Both runners have. Okay, so instead of following the 10% rule.
So what you're saying is you haven't heard it.
Someone.
For those who haven't, the 10% rule would be that you should not run more than 10% of your previous week's mileage, total mileage. So,
Will you say that again?
So the 10% rule would be that you should not run more than 10% of the previous week's mileage. So if during 1 week you are running a total of 20 miles, that following week, the next week should not be more than 22 miles.
Don't go do math on my spreadsheet.
Or tests. And so the number one reason why people get hurt is some interruption of that. Or it's a novice and they go out and they're running a couple miles and everything feels good and it's a beautiful day like today, and they go out and they run, they're used to running 3 and they run 10 because it's so nice and they're feeling great, and next thing you know, 30 is killing them. So it's usually a training error like that. Could be improper footwear. You should be in a neutral or maybe a stability shoe, and you like the way that this motion control shoe looks really well, it's real fancy, and you decide to get that one instead, or vice versa, you go to a normal shoe that could cause problems also. But number one would be a training error, either from footwear, running too much too soon, or maybe a change in surface. You're used to running Memorial Park loop that has a nice gravel surface, and then all of a sudden you're used to running 3 miles around that, and then you decide to run a 10K and you're running it on cement, and then maybe that's the problem.
And one thing, if you don't mind, I'd like to add is, I think this is important to understand, is everyone's going to get hurt. So you want to minimize it. But if you don't get hurt, you're not trying. And that's what my coach has said. Now, you don't want to get hurt every year, but if you're trained year after year after year, you're going to step off the curb wrong. Karma's going to bite you somehow. You're going to get hurt. We want to minimize it, but don't think there's some magic person out there who competes at a high level for 30 years and doesn't get hurt. Every world-class athlete, all the way down to us, everybody gets hurt. You just want to minimize it and control it and have the best results you can. But please don't think that if you do everything the right way, you won't get hurt.
No, you can do these exercises so you're building the face.
You're going to do something.
Something's going to happen. You're going to step wrong. You're going to have to do that extra run because just life got in the way and time didn't.
But you'd like
work
it
out.
to be a 3-day problem and not a 3-month problem.
Right, and listen to the injury. Don't just keep running through it. Right. Okay, and so I've got a list of three different. Pardon? Yeah, sure. Yeah. We have kind of 3 different phases here. This first phase is just doing some different leg lifts, okay, or bridges and some basic isolated hip strengthening. All right. The exercise I've chosen here were kind of the top groups that favored gluteus medius over that tensor fasciae lata muscle that touches the IT band. So typically what we want is for these muscles to be isolated versus the muscles towards the front. Kind of the mid-range would be a couple of side plank progressions, and then finally a couple of different squat variations, a split squat or a lunge like so, and then also practicing a single leg squat. So when we get to the squats, the reason we're doing single leg type of stuff is running, again, is single leg activity. We're jumping from one leg to the other. So we can, if we're having problems, we can start off with just a basic regular squat, but we're squatting on both legs, where it doesn't really cross over really well with running because we want to do more of a single leg activity. All right? Con, you ready? Yep. Okay, so first exercise, go ahead and lie on your side facing the crowd. That's the first
Somebody get
Yeah. There we go. Got it.
Is it on the Facebook page?
Yeah,
So the good thing about these exercises that we're about to go through here is that they're simple, they're pretty straightforward, and they isolate this muscle. The bad thing is we're lying on our side, which does not, running is upright, so it's not perfect. But these are more for when you're having a problem and you want to do something about it, but you're not running, or just a little bit, maybe a little bit of tune-up before or after a run. Okay, so let's put both knees together. Okay, we're going to bend both knees like so. Perfect. We call this one a clamshell because what we're going to do here is the resistance. I've got a couple of freebies here. Someone really wants to take one home. Okay, so here's the exercise. What we're going to do is you're going to keep your feet together, and you're going to lift this knee up off of the other one. Exactly like that. And then come back down. Okay, let's do about 5 reps. How does that feel? Yeah. Okay? Yeah. So the thing you want to watch for this is that we want to also incorporate our core a little bit and keep our back and hip neutral. So we want one hip on top of the other. That's exactly right there. Okay. Just like that. Okay, so you should be feeling this right through here. Mm-hmm. And a typical prescription would be 3 sets of 10, or maybe for runners 3 sets of 15, because we want more of an endurance or more reps.
Do you want speed or you want power? Or both?
Well,
how do you define?
That's a good question.
Really slow.
Do you want leg up here?
It's a good question. So yes, I would give it about a 5 seconds hold to lift, hold, and then back down. Lift, hold, and back down. With all these exercises, we want, it's not, don't think in terms of like workout video, what we want is control. We want control of these different movements, okay? All right, next exercise is just going to be a sideline leg lift. So all the way straight, so we go same side. Okay. We're going to wear this side out.
Okay.
Okay.
Sounds good to me.
What we want to do is make sure everything is lined up. We want our ankle bone, knee bone, hip bone, and shoulder to be all in a line. Okay, go ahead and lift this leg for me. Again, we're going to go about halfway up through here. Good. Hold that there, and then let it back down. Okay, do that 5 times.
Where's the engagement?
You should feel it through here.
Mm-hmm.
But, so the tendency, do you feel how you want to roll back like this?
Mm-hmm.
So we want to make sure that we are staying straight like so. So I do encourage people to hold themselves like this. Another way to do this would be to put yourself up against a wall. So find like an empty wall in the house. Shoulders, butt, and feet all up against the wall to where you're in your socks, and have your heel drag up and down the wall. That'll ensure that you are in a straight line.
Is it for the medius?
This is all gluteus medius, yes. The first one will incorporate some gluteus maximus with that rotation, but it's still going to, and piriformis, we all heard of the piriformis syndrome. It'll include some of the piriformis. Okay? All right, on your back. Okay? This next one's going to be a bridge, so bend both knees for me. Okay? Let's just do a regular bridge. Okay? Now for everybody in this crowd, this is going to be way too easy. All right? This is using both legs, so come back down. All right? So what we're going to do is you're going to extend this leg out. Okay? You're going to keep it in line as if they're connected. Okay? And now what you're going to do is you're going to lift up using just this leg. Hold it 1, 2, 3, 4, 5, and then come back down. Now this will be gluteus maximus and gluteus medius. Okay? If you want to get real fancy, you can put a band around the knees to where you're having to keep them separated, and then back down. So about a 5-second hold. Don't let the knees touch. So what I don't want is to be up here or down here. Okay? So we can
Angle.
Yeah. Engage the abs, engage the glutes. Hold 1, 2, 3, 4, 5, and then back down. Good. A couple more reps. Okay. All right. Now, let's go ahead and get onto all fours. So this next one is primarily gluteus maximus. It's a good way. So runners in general tend to not fire their glutes in general as much. So we also want to make sure that we get gluteus maximus involvement here. So for this one, we want to try to maintain a neutral spine. All right. So arch your back down for a second, just like that. Now arch it up. So what we want to do is find the middle. So come down the middle right there. So you're going to engage your abs. I don't want any movement left or right here, okay? And I don't want any arching through here. So keep those abs engaged. And what you're going to do is you're just going to lift this leg behind us, like so. Okay, so we want to stay neutral through here. Now, you're leaning towards me a bit, so kind of peek down here and keep this leg fairly vertical, right there. Okay, good. All right, so now here's the thing. So he's not all the way up yet. If he forces it to go up, he's going to arch a little bit here, right? So I'd rather you stay neutral and work on your core through here and only get up as what you can, and then eventually, it's not easy, right? So that was pretty good, and then come back down. Let's do 5 reps. So I would go slow on this.
Let's do 400 reps.
Okay. My win?
He'll do it.
And let's work on not arching our back through here. Good. Just keep those belly muscles tight, and then back down. Go again. Good. That's better.
Just go, did a brief rest, like a 2, 3 second
1,
rest?
2, 3, yeah. I give it 3 to 5 seconds. What we don't want to do is just knock them out. We want to be in control, hold it for a second, and then come back down. Feel for your butt to contract through there. Good.
Oh, it's tight.
Do some on the other side. So I want you to come back down.
Just run on the left side.
I want you to imagine that I have a glass of water here, all right? And I don't want you to spill that water, all right? So keep this, there you go. There, that's much better, much better. I notice you're not getting as high here, but that's fine, that's fine. If you, as you work on this, that would get closer. Does one side feel any different than the other? Ah, that makes sense. Because they look different.
Yeah. I cannot bend my right leg.
So you're probably somewhat familiar with a couple of these exercises from your ACL rehab.
Yep.
The worst thing about these exercises is realizing how unbalanced we all are.
Totally.
Like, that's easy. Oh no, the other side's terrible.
Right. As you do it, you'll say, okay, well, that side's hard. Then to the other side, you're like, well, that's not even hard. It's also hard and awkward. So just getting it all figured out.
Hey, Brian?
Yeah.
On that exercise, I had somebody tell me to do, like, to put like a broom or something
Yes.
down the center of my back to,
Right. So
to check that.
what we'll do in the clinic is have a piece of PVC pipe rested on the head through here, and usually would have a PVC pipe with a little kind of an elbow at the end to where it won't roll off too easily, to help kind of give an idea of where we should be with that. So yeah, good suggestion. All right? All right, go ahead and stand all the way up. Right there for me. So back to our Pear band through here. Stand with your feet together like so. All right, so for this one, what I want you to do is I want you to stand there with your knees bent a little bit and hips back like you're playing middle linebacker here. Just too deep. A little bit up. Kind of get into your maybe as you, just like that. Perfect. Okay, and what we're going to do is we're going to take a couple steps to this shirt over here. Like that. So this is probably, out of the ones we've got done so far, this is probably number one, top one to do. Our foot is in contact with the floor, like we're running.
It is important to have the toe pointing in the direction.
That's exactly what we should do, is have those toes pointed forward. And if you have that asymmetry or you have a hard enough band, you'll notice that as you push, that knee wants to drift inwards. And so we want to make sure that it's pointing straight as we go.
Should we hold for a second or continue?
Controlled. There's no need to hold it like that, but what we don't want is to go out, and certainly we don't want that the trail leg just to snap into place.
Okay. Resist.
Mm-hmm. Just control it back towards us here.
So keep tension in the band.
A little bit, yes. So I typically like to have people start off and tie it where it's together, and then start with your stance like so. Medium step, like we don't want to go way out. So here, medium step, and then back. Medium step, and back. Just like so. And so one thing, he looks pretty good. One thing that I see in the clinic a lot is if your hips and core are a little bit off, is as you get tired, you will tend to tilt like so. So we want to make sure that our body stays vertical, our trunk stays vertical as we're walking side to side.
So how many steps side, like 10?
I would say 3 sets of 10 to 15.
Okay.
If you do 3 sets of 15, find a stronger band.
Okay.
These bands, I'm going to give some to folks tonight, but you can buy this. The brand is TheraBand. I don't rep for them or anything. This is what we use in the clinic. If you want bands like this, I see them at Academy. You can buy them on Amazon. The colors represent different strengths. Okay, so just find. And the deal is you can't just do it and feel fine. You have to do it to the point where you feel like you're getting some work. Yeah, feel those muscles burning. All right. All right. So stage 2 would be incorporating that strength into some core work. All right. So I want you back down on your side, facing the crowd again.
Oh, it's going to work.
Different side this
Do you
time.
need me to move?
Okay.
Oh, no,
So I
no.
want.
Do you have a question?
Yes. Yeah.
No, can you do this like after run, before run, or what?
That's a good question. So typically what I tell folks is to do, it's a good way to get warmed up, kind of get the muscles tuned up before a run, okay? Then I also do it afterwards, because afterwards, especially after a short run, because you've already got the muscles working, they're fatigued to a little bit, and then that way you can just kind of knock them out and really fatigue these muscles up here. Good question.
Got balance. See, you got re-engagement right here. Effort.
All right, so I want bottom leg bent, top leg straight. Well, let's just go both legs bent to begin with, okay? And this is going to be just our basic side plank. Get your arm underneath you, forearm against the floor. So I'm going to demonstrate. It's easier for me to demonstrate. So more so like that.
Okay, plank.
Exactly like that, okay? So what this is going to do, we're going to activate those hip muscles here, but it's also going to incorporate our trunk. Our low back muscles through here, abs through here. Perfect. So we want to be a straight line through here. We don't want to overdo it and go way the heck up. We want nose, middle of our chest, belly button all in line. Good. All right, go back down. Okay, so that's side plank. This, people go crazy with 30 seconds, minute and a half. I like to do 30 seconds or so, and then if that's not too bad, I like to make it more difficult in other ways. So what we're going to do is make this leg straight, bottom leg bend. Okay, we'll get things back in line. Good. Go ahead and do our plank. Get the hip and shoulder forward, just like that. Hold that there and lift this leg. Hold it, and then back down. How's that? Okay, let's keep these hips up.
Give them
Lift
some
up
wine and do it again.
And let's do a set of 5. and back down. 5 reps. 1, 2, 3, 4, 5, and then back down. So squeeze forward to where, yes, right there. 1, 2, 3, 4, 5. Which side is your ACL on?
Right leg.
Right leg. Good. So that looks like it's about right. Let's try one more thing. Let's go both legs straight. Both legs on top of each other. So this is going to be harder because we have longer levers now, right? So let's go ahead and plank up. Good. So now that looks good. Now see if we can lift the leg up. A little bit tougher here. And back down. Up.
It's getting hard.
Move your hands in closer.
No, so let's have an experiment. Let's do the other side and see what it looks like.
We're like 1,000 cupcakes. Yeah, give him some wine. Make him do it.
There we go. Now that leg. Okay. Do you feel much? It looks pretty similar. Do you feel much different?
Yeah,
Yeah.
a little bit. Yeah,
A little bit different. This side's easier or harder?
easier
Yeah.
because this leg is doing all the work.
Yeah. So this is pretty tough. So he's pretty good. All right. Very good. Okay, and finally we need to incorporate that into something that's more upright. All right. And so let's do what's called a split squat. So a split squat would be, let's get down onto one knee. You also be, so a lunge. You'll see some folks call this a lunge. But a lunge is more of like where you're here, you're back, and you come back up, which is fine. Or a walking lunge where you're taking steps. But to start off with, until you get the form down, I usually just start with a split squat. So we want front leg, knee to be in line with our toes like so. Back leg, knee, hip, and shoulder in line like so. Upright, and we're gonna come straight up.
Oh God, that's hard.
Okay. So we're gonna keep that stance, and we're just gonna come up and down.
That's a lot of work.
And so runners are notorious for not being able to, because in running, you're in this position all day. You know, you can run for miles like this, but rarely are we squatting or getting down like this. So it's a good cross training type of thing to get more of a range of motion, or strengthening in a different range of motion. So you see a little challenge with this.
Yeah, this is a challenge.
Keep that trunk upright a little bit more. Okay, let's do the other way. This will work.
Yeah.
So not bad. Oh, did you run today?
Yeah.
That's part of the problem.
A lot, too.
Running's always the solution.
Okay, good job. All right.
I got work out tonight. I can work out with you tomorrow.
He still has both legs on the ground. This leg is not helping as much. This leg is doing most of the work here. So the next step up would be single leg squat. So you see variations like a pistol type of squat. But typically what I like is just to get your balance. And this is also, you want to be in control with this. You don't want to just knock them out and be all over the place. You want to focus on control and balance. So we're here, to there, and then back up. I did not run today, so that's fine. Just like that. Okay?
What happens if your knee drifts?
Good question. Okay, so this is my weaker side. So
What was the question?
what happens if your knee drifts? Okay, so let's say that you're doing it, and we go back to what I talked about earlier with hip muscles not being there. So what this does, this incorporates everything to where these hips need to be engaged through here to hold my knee in line. So let's say I'm doing my exercise and I notice that my leg is doing this. That's not good. All right, so if that's happening and you can't, so I usually suggest doing this in front of a mirror at first, at least. Okay. That way you can see, because what also can happen is you can be here, but your trunk can be way off like this, neither of which are good, because we don't want to be running
Sideways.
like so, right? So we want to be here, shoulders, everything in line, like so. So if you catch yourself drifting like this and you can't correct it, you don't have the control to get back. You need to go back to either a split squat, and you can potentially drift with this also. That's still not good. So if you're still doing that, then you start up, then you go back, backtrack. It's just a regular squat, both-legged squat. And make sure that everything, so as we squat, hips, knees, and feet should be in line.
And that's with in or out, either one. Or so which one, is it the split squat is for when your knee is going in, or?
Well, the knee should not be going in. The progression would be, this is the hardest, single leg squat would be the hardest.
Yeah.
You do it like so, or you do it with your leg going behind you. That'd be the hardest. Split squat would be the next hardest, okay? So if you are doing single leg squat, and you notice and you can't fix that,
Yeah.
well then you need this other foot on the ground to take some of the stress off this leg. That'd be the next one, back. If your leg is still drifting in like so, and you can't control it, well then you need both legs firmly on the ground, like so.
What if it's going out that way?
That's fine. Most of us can't even get that far out.
Okay.
Okay, but having said that, you want your feet to be secure on the ground. You don't want them rolling out to the side either.
Yeah. I've just noticed that.
How far should you have your feet apart?
For a squat, like a two-legged squat. Good question. All right. For a two-legged squat, we want our feet to be about, now this is a different answer for everybody, so this is general terms, all right? So, but in general, shoulder width. So if I draw a line down from my armpits, should be about where my heels are, okay?
Inside, outside the heel.
So it's your heels, not your,
Ish.
not your chest.
Say it
Bad
again.
question.
Your heels, not your toes.
Your heels should be about shoulder width, yes. Toes, for most of us, our toes need to point out 5-10 degrees, all right? As we squat, those knees need to separate and be in line with, probably, the book will say second toe. So, like so, not like so. All right, does that make sense? So, a good squat would be here, feet about 5 degrees, knees separated, back up. All right. Any other questions? All right. Well, I will hang around for a little while, and I brought my card. Everybody wants to take my card. I brought 3 pictures or 3 stacks of papers of those different exercises that I just showed, and a few pieces of TheraBand.
A PDF file.
Can you explain the different colors, like which one is more intense?
Yeah.
Or like which one is tighter?
Yes. So different manufacturers have different codes, but
The exercise 3.
for this manufacturer we have, I didn't bring yellow because none of this crowd would need it, but red's the easiest of these, then green, then blue, then black. I didn't bring black.
What's the Oh, the darker. Okay.
Yeah.
What's the manufacturer?
TheraBand.
TheraBand?
TheraBand. Yeah.
Awesome.
My card has my email on there, so feel free to email me any questions. I'd be happy to answer them. Yeah, I can. Yeah, I'll send maybe the PDF of all these. Yeah. Yeah. Sure.
One of the things that too that to remember also is all this stuff is very good for prevention of that. Don't wait like me, I'm a horrible patient, and I don't treat them like I should.
Yes, ma'am.
When is that a good idea to use stability people in the squats?
Right. So that would be somewhere in between doing a regular squat and going to a single leg. Okay. So this so like a Bosu, like upside down Bosu ball. Everybody knows what a Bosu is. So like one side has a platform, one side is round. So what we'll do is turn that thing upside down to where you're on the platform, and so maybe you're really good with regular squat, but then you get up there and you shake like so. So it's an unstable surface, and so it'll be somewhere in between of doing a two-legged squat to the split squat or one-legged squat. Anything else? All right. Thanks, guys.
Before you leave, we're wrapping yourself 3 pair of free shoes. If you leave, you are not eligible to win. So while we're figuring this out, y'all like shop.